Hi, I'm Dr. Prakash Pania, Specialist Endocrinologist, Aster Medical Center, TM Healthcare, Dubai. Over the next few minutes, I shall be talking to you about a subject which is very close to my heart, and that is diabetes. Diabetes is a growing epidemic. Every 10 seconds, 2 people are diagnosed with diabetes. Every 10 seconds, 1 person dies of diabetes. It was estimated that there were 285 million diabetics in the year 2010, and that number is projected to rise to 438 million by the year 2030. And that's not all. For every case of diabetes which is diagnosed, there is one which is yet to be diagnosed. So it's just the tip of the iceberg. In UAE itself, there are plenty of diabetics. UAE has got the second highest prevalence of diabetes in the world. 20% of the population of UAE is diabetic, and 25% of the local population of UAE is diabetic. That's how large the numbers are. What are the precipitating factors for diabetes? Hereditary factors, stress, physical inactivity, sedentary lifestyle, and poor eating habits all contribute towards diabetes. These lead to obesity, and obesity in turn leads to diabetes. Diabetes and obesity together are called diabesity, and diabetes is also commonly associated with blood pressure and cholesterol, and together diabetes, obesity, blood pressure and cholesterol are called the deadly quartet, and these are silent killers. So after having said that, let us define diabetes. What is diabetes? In diabetes, there is a dual defect. The pancreas doesn't produce enough insulin, and whatever insulin it produces is not able to act properly. So basically there is an insulin deficiency, and there is an insulin resistance. How do you diagnose diabetes? Diabetes can be diagnosed by either checking a fasting blood sugar, checking 2 hours after the food, after giving 75 grams glucose and checking 2 hours later, or by an entity known as glycated hemoglobin or HbA1c. There are various diagnostic criteria which a doctor will tell you and will help you diagnose diabetes with confidence. Once diabetes, always a diabetic. And diabetes can be treated, not cured. Having said that, what are the types of diabetes? The various types of diabetes are there. The commonest is the type 2 diabetes, which is commonly seen in middle-aged and elderly people, usually associated with obesity. Then there is the type 1 diabetes, which is usually also called as juvenile diabetes. Then there is a diabetes which comes out in pregnancy, known as gestational diabetes, and this may be temporary and may disappear after the delivery. And then there are other types of diabetes which occur because of certain drugs or certain pancreatic disorders, etc., etc. So having said that, what are the symptoms of diabetes? Diabetes can manifest with a lot of symptoms, the commonest being excessive thirst, excessive urination, unexplained weight loss, blurred vision, fatigue, and generally feeling of tiredness. This is what people associate with diabetes, but mind you, the commonest presentation of diabetes is that it can be asymptomatic and without any symptoms at all. Hence, a high index of suspicion is required in the high-risk patients. Screening is required so that we can pick them up at the earliest. So, is it the symptoms of diabetes only that we are worried about? No, not at all. We are worried about the complications of diabetes which it can cause if it is undiagnosed, undetected, and uncontrolled. So, what are the complications of diabetes? Diabetes can lead to complications from head to toe. No part of the body is spared from the complications of diabetes. The commonest being the nerves, the eyes, the kidneys, the heart, etc., etc. Cataract leads to blindness, but diabetes is the second largest cause of blindness. Diabetes also is the commonest cause of kidney failures. Diabetic patients have 2 to 4-fold high risk of developing heart attacks, and that's why diabetes has to be treated on a war footing. How do you manage diabetes? You manage diabetes by doing your deed well. Deed? Yes. D for diet, E for education, E for exercise, and lastly D for drugs. A proper dietary advice from a certified nutritionist is very, very important in the treatment of diabetes. Without that, even insulin and medications won't work. Education. The patient should know about diabetes, and only if he knows about diabetes, he can tackle diabetes. Exercise. Exercising is important to control the diabetes because it takes care of obesity and makes the insulin in the body work more efficiently. And lastly, drugs, where you have medications, insulin, and newer agents which are coming out. So what does the future of diabetes have in store for us? We have newer drugs which are in the horizon. We have oral insulin which will probably be coming out. We have nasal insulin which will be coming out soon. You have insulin pumps. You have newer and newer devices of insulin which can inject insulin. Then you have pancreatic transplants. You have continuous insulin infusions, and you have stem cell therapy. So there's plenty of hope for those diabetics who are looking for a cure for diabetes. Having said that, prevention is always better than cure, and that's why it is always better to pick up diabetes at the early stages so that we can tackle it aggressively. And I would like to conclude by saying that we have to bring diabetes to light. We have to spread awareness about diabetes so that we can extract the sugar out of the patient's blood and sprinkle it and spread it in their lives. So sweet, no? Thank you.